Here we go. Question number 6. The nurse is caring for assigned clients. The nurse should first assess the client who, what. Now, this should tell you right here, right now, that this is a management of care, prioritization, right? Delegation, assignment, supervision type of question. All right. I'm just saying, sometimes it'll narrow down what the topic is. All right. So is it number 1, an infective endocarditis and a temperature of 101.5? Is it had a heart transplant 2 months ago and has sustained sinus tachycardia of 110 beats per minute at rest? Had a coronary stent placement via the femoral artery 3 hours ago and is reporting severe back pain? Or is it had coronary artery bypass graft surgery 3 days ago and is reporting swelling of the extremities used from the donor graft? What are we thinking? And the answer is number 3. The answer is number 3. A client who undergoes percutaneous coronary intervention and intracoronary stent placement using the femoral approach is at increased risk for retroperitoneal hemorrhage. Administration of antithrombic or thrombotic drugs before, during, and after a PCI can exacerbate potentially life-threatening bleeding from the femoral artery. Hypotension, back pain, flank ecchymosis or Gray-Turner sign, hematoma formation, and diminished distal pulses can be early signs of bleeding into the retroperitoneal space and require immediate intervention. So that's when you want to notify the healthcare provider. You want to do serial CBC, CT scan of the abdomen because we want to make sure we didn't create a AAA. Here we go. Question number 7. The nurse is caring for a client who sustained a fracture of the right tibia and fibula. Which of the following factors would increase the client's risk for delayed bone healing? Is it a BMI of 29.5 kilograms? Is it a family history of osteoporosis, history of peripheral artery disease, or consumes 1 glass of wine per day? What are we thinking? And the answer is number 3. All right, the answer is number 3. Bone healing depends on multiple factors, including nutrition, circulation, and age. A client with peripheral artery disease has decreased perfusion to the extremities due to atherosclerotic changes in the arteries. Without adequate perfusion, the bone is not supplied with the oxygen and nutrients required for healing. Question number 8. The nurse is assessing a client who has a pressure injury. The nurse notes a clean, shallow, dark pink wound bed. Okay, the nurse documents the pressure injury as what? Stage 1, 2, 3, or 4. Shout out to all 280 of y'all. Hey, a little bit about me. I was an ICU nurse. I did OR and I also worked PACU. All right. I actually just got out of the Navy. I did 16 years. For those that don't know, I was an instructor for the last 7 or 9 years. I was on active duty. And I taught in a surgical technology program. I've been doing education for the last almost decade. So that's why I like doing this. That's why I like coming here, doing these all the time for y'all. And I appreciate y'all being here. Now make sure y'all answer this question. What are we thinking? The answer is number 2. Pressure injuries are caused by long periods of external pressure that compresses dermal capillaries and the underlying soft tissue. Friction against the skin and shearing forces can also contribute to pressure injuries. Pressure injuries are staged from 1 to 4 to classify the degree of tissue damage and determine the most appropriate and effective wound treatment. A stage 2 pressure injury involves partial thickness skin loss, right, that extends to the dermis. The wound bed is red or pink and may be shiny or dry. Here we go. Question number 9. The nurse is preparing to administer NPH insulin and regular insulin to a client who has received the breakfast tray. Which of the following actions should the nurse take? Should they administer NPH insulin and regular insulin in 2 separate injections? Administer NPH insulin now and regular insulin after the client has eaten? Administer NPH insulin and regular insulin in the same syringe, drawing up the NPH first? Or same sentence, but draw up the regular insulin first? What are we thinking? And the answer is number 4. The answer is number 4. Here we go. Intermediate acting insulin can be mixed or can't be safely mixed with short acting insulin or short-acting and rapid-acting insulins in one syringe. Question number 10. The nurse is caring for a client who is receiving a transfusion of packed red blood cells through a peripherally inserted central catheter, right? During the transfusion, the client receives a new prescription for IV amphotericin B. It would be most appropriate for the nurse to what? Administer the amphotericin B through an open lumen of the PIC, insert a peripheral venous access device and administer the amphotericin B, interrupt the transfusion and administer the amphotericin B, or wait 1 hour after the transfusion is complete before administering the amphotericin B. What are we thinking? And the answer is number 4. The answer is number 4. Amphotericin B is an antifungal medication used to treat systemic fungal infections. It is commonly associated with severe adverse effects, including hypotension, fever, chills, and nephrotoxicity. Due to the similarity between the adverse effects of amphotericin B and the symptoms of a blood transfusion reaction, i.e., chills, fever, hypotension, and kidney injury, the nurse's best action is to complete the blood transfusion and allow for 1 hour of observation before administering amphotericin B. This enables the nurse to distinguish between transfusion-related reactions and adverse effects from amphotericin B.